Anyone who's had surgery, especially those of you that have some kind of orthopedic surgery, it's Olympic season and we're watching all these athletes wipe out and get injured, which is terrible for all the, effort and training that they put in to see them get injured when they're trying to compete at the highest level. But anybody that's seen or had an orthopedic injury or any kind of other injury that limits their function, I would recommend highly that you seek physical therapy. And unfortunately, in the way our healthcare world works, that's not always being the option given to patients when they have surgery. Unfortunately, a lot of times in the last 10, 12, 15 years, there's even been surgeons who are not promoting physical therapy at all after things as invasive as a total knee replacement, total hip replacement, total shoulder replacement. So you're replacing an entire joint, and patients are being told to just go home, follow these exercises on a sheet, and you'll be fine. And I can speak personally on a lot of different examples of where that did not work. So I would highly, highly recommend that if you have something going on that's going to limit mobility, limit your function, limit your strength, it is very, very difficult to get it back on your own. That's why we have a profession. That's why PT exists. If it didn't, we wouldn't have a job. But it is an important part of your rehab process, and it's sad to me because I'm very passionate about what I do when I see patients that are driven in the wrong direction when it comes to their health care and their recovery and their rehab. And then sometimes not even surprised by the medical professionals that there's not a great outcome. And the problem is the patient is the one suffering with that lack of outcome. So I would just advise and just really strongly encourage anybody who's going through anything like that, whether it's, again, an orthopedic injury or whether it's a surgical procedure, to definitely request physical therapy. If the doctor is denying it, then I would call an office and ask them to come in and be evaluated and see what we can help you out with.